The most common symptom of a heart attack is chest pain or chest pressure, and sometimes people refer to it as someone sitting on their chest or pushing on their chest, and it usually feels somewhere in the center of the chest. Because the heart doesn't have its own nerves and it uses the nerves of the chest wall, that pain can be different for different people and can be in different places. Sometimes it starts as chest pain and goes to your neck, or can go to your left arm or left shoulder, sometimes the left hand. Anytime that you feel something very out of the ordinary for you that would feel like chest pressure, especially if it's occurred after heavy exertion or during exertion, that's something you need to be evaluated right away. Even call 911 if it's really severe. Women tend to have more atypical symptoms of chest pain, especially diabetics, and so risk factor control becomes very important in those situations. In general, though, most people, I would say a large number of people, when they're having a heart attack, do have some component of chest pain, very profound shortness of breath, sometimes sweatiness we call diaphoresis, where they're just covered in cold sweat and feeling like they have to throw up. Generally, the body knows something is wrong and it's sending a signal to the person to go get help, and that's when, if you feel that kind of panic, that's when you need to call 911 or get to an emergency room. So the most important thing in survival with heart attacks is getting early and immediate medical care, and that's why we're big advocates of 911 and calling an ambulance, because the ambulance has the necessary tools to treat someone in the very early stages of a heart attack, and we know treating it early is what helps people live longer. The other things you can do at home while you're maybe waiting for the ambulance or on the way to the emergency room is chew a full-strength aspirin. We know aspirin also reduces the chance of dying when you have a heart attack, so that's always a good idea. One of the biggest problems we tend to see in the hospital is people waiting too long to get treatment. They're having chest pain. It seems to be out of proportion to what they've had in the past. It's been with exertion or after exertion. They feel sweaty, they feel short of breath, but for whatever reason they delay treatment. And these people tend not to do very well. First, it's very dangerous. If the heart does have a blocked artery, you could certainly die. And the second thing is, if the heart isn't getting enough blood, the longer you wait to get blood back to the heart, the more long-term heart problem you could have. So I really encourage people, if they're suspicious, remember there's only one you, have yourself evaluated.